Hi, everyone. Happy Sunday. Today is January 4th, 2026, and this is my third episode of my car therapy residency after hours series. If somehow the gods of social media algorithms got this to your feed, my name is Veronique. I am a first year general surgery resident. I am an osteopathic physician and an active duty military captain. I am also Catholic, which will, for this video, become relevant in a few minutes. I started a car therapy series because over the course of my 6 months in as a general surgery resident, I have been having little realizations about myself, about the way that things are going with residency, about different anxieties that I had. And I thought that I would make a post a day about what is going on in residency, how I'm feeling about things, little evaluations of myself. Um, Today, after 6 months of residency, I start my second half of my first year on night shift this morning. I wasn't intending to make a very long post about anything because I haven't really done anything since the beginning of the year. However, this morning, when I opened up my Facebook, as most of us do in the morning, I saw a post by the American College of Nursing Midwives about a Dr. Janelle Green Smith or Janelle Smith Green who had passed away due to complications of childbirth. This was a midwife who had passed away due to complications of childbirth. A person whose life had been dedicated to making sure that women were giving birth safely had passed away from complications of childbirth. This is not the first time that this has happened, right? And over the course of the last couple of years, whenever this happens, even last year, as a person who I enjoy telling stories, I think this is something that I want to do with my life, like in residency, is to be able to talk about like different things that happen in different patient stories that impact me. Over the last year or so, we heard a number of stories about Black women either being denied medical care, being turned away from hospital, being really treated quite egregiously in hospitals, Black women that came there for purposes of childbirth. We remember the lady down in the Texas hospital that was essentially turned away at the door and had to have her baby in the parking lot because she was in labor and she was discharged from the hospital. There was the lady in the YouTube video or the video that was circulating on social media who was in active labor, squirming in a chair in the emergency room. And the nurse who was doing her intake was just so completely unconcerned about this woman, so completely just unfeeling to the pain that this woman was going through. I, at the time, was buried in like trying to figure out what first year of residency looked like, and I hadn't decided to do any of these things. I had not decided to talk about this today, but if you watch my little video from yesterday, I talked about how my husband and I are currently, for the first time since we started dating, living in the same house. We recently got married, and our next step, given that we are both in our 30s, our next step is trying to figure out how to start a family. As a Black woman, as a physician, as a person who is looking forward to starting a family, there is nothing scarier than envisioning or thinking that I would walk into a hospital one day, heavily pregnant, and not be able to trust the hands that are touching me. That I would walk in there and live in abject fear that I will not be able to get out, that I will not be able to see my baby, I will not be able to raise my child, my husband would be left without a wife, my family would be devoid of a person important in their lives. I started this series because I had a series of different anxieties that had come up as an adult, as a resident, as a newly minted physician, as somebody that was just trying to navigate the challenges of adult life. To think that we are still, Black women are still very disproportionately mistreated. Black women are still dying of maternal fetal mortality in this day and age, in 2026, when there are advances to medicine that would blow our mind, when people are curing sickle cell and HIV, and there are robotics for treating bariatric surgery and for treating bariatric patients, and there are all these different advancements in medicine, to think that we as Black women are still struggling with walking into a hospital and not receiving proper care. It is mind-blowing to me. It is very, very heartbreakingly mind-blowing to me. I walk into the hospital every day, even as a baby doctor. And in my brain, I think, like, what am I going to do today that would be the best thing for patients? And where I work is a safety net hospital, which means that irrespective of color, creed, denomination, political affiliation, language, you show up and you get excellent care from the door. This has nothing to do with like EMTALA laws, the ones that tell you that if you come in and you show up in an emergency room, people have to treat you. Yes, but I have seen the surgeons and the attendings and the residents in my program treat people. I have seen the nurses take care of people that honestly sometimes, like, it's, some patients come in and they stretch you to your limit. Some patients come in and they are emotionally taxing. And every day our attendings show up. Every day our residents show up and they treat every single person. I don't understand. I don't understand where these hospitals are. I don't understand the situation. And I get it. Like, we talk about systemic racism and we talk about all of these things. When the video of the woman who was mistreating this Black lady and she was crying and all of this, I think later it said that that woman had been fired. The nurse had been fired. That's all well and good. But the thing that struck me about that is that whole encounter was happening in an emergency room. That whole encounter, like, there wasn't one person in the hospital. It was a nurse. There were people in that emergency room, and nobody thought to look at this woman and go, how the heck do you call yourself a nurse and treat somebody like this? The woman who was discharged in active labor, nobody in the hospital thought to rush after that woman and go, you really shouldn't be out here. No one thought to confer with whoever it is that had signed those discharge papers and go, do you really think that we should be sending this woman out of here? One of my favorite shows of all time since I came to America is Grey's Anatomy. I've watched every single episode of Grey's Anatomy, some of them probably multiple times. Every time I hear of a story like this, I think about the episode where Derek Shepherd gets killed off, where he gets hit by a car and he's undergoing this like neurosurgical procedure, and he knows, because he is a neurosurgeon, because he would have successfully done this treatment, he knows he's going to die. I think about not only the Black people that go into hospital, and we talk about like Black people having mistrust of the healthcare system. It happens even with us Black people in the healthcare system. You see your fellow Black person that comes in and they don't trust you because they don't trust the system. What breaks my heart is that the people who are dying in hospital are not only the people that come off the street that have like limited education, limited language, not who have language barrier issues, who are immigrants, it's not those people. It's not just those people. It is educated people, people who know what the healthcare system is like, people who understand biology. I wonder how somebody like this, who has dedicated their life to bringing life into the world, could walk into a hospital and not come out. I don't understand that. I don't understand how even, and I know that the person's education level doesn't mean anything, but if we are this callous with the lives of people who know how we are supposed to operate, then how much more of the women coming off the street with a high school education, how much more of the people coming off the street who don't understand what we are doing to them? How is this okay? I often think it's funny, and this is going to be a little political, so I should have prefaced this video with like, I'm employed by the United States Army, I'm employed by my hospital, and these views don't reflect my employers at all. That being said, when the current administration came into power, there was this whole thing about like, oh, we're going to give people $5,000 to have babies because our like rate of our birth rate was down or something. I don't really follow politics. It's exhausting. But at the time I thought, imagine that. Imagine someone handing women $5,000 to be baby carriers. No one thinks about how are these pregnant women going to go through 9 months of pregnancy? What processes are put in place for people who are working women who also want to have kids? What processes are put in place for after childbirth? We never think about, no one ever talks about like postpartum blues. No one ever talks about postpartum depression. No one ever talks about postpartum psychosis. No one ever talks about these women trying to go back to work. The number of women who have been fired from their jobs during maternity leave, the number of men who have been fired from their jobs because they tried to support their wives during their maternity period or during maternity leave. People who don't have access to healthcare, people who don't have access to physicians, they stay in their houses and they're scared to go to the hospital. People choose to deliver babies at home with doulas and things like that because of this very issue. We scorn these people. We say, oh, you need to come and have your babies in the hospital. Oh, women need to have babies. Oh, we happen to be like super pro-life and whatever. And no one ever thinks that this is what is really going on in our healthcare system. In this country, which is considered one of the most developed countries in the world, women are still dying from childbirth. Black women are still dying from childbirth. I'm from Cameroon originally. The last time I heard about a woman giving birth on the street was in my home country 5 or 6 years ago. This is a country that is rated as a third world nation. A woman is turned out from the hospital and her family member has to open her up and remove her babies because the hospital would not do it. That's over there in Cameroon, in a third world country. What is the excuse here? What is our excuse? Is it really government? Is it really politics? Is it really that we have no humanity? Like, we stood, all of us healthcare professionals, and took an oath that we want to serve and protect. Is this really how little people think of other people? People think of Black people. Are we still in that day and age? What do Black women have to do to get good healthcare? What do we have to do to feel safe? This doesn't make any sense to me. Like, I get the politics, I get the Republican, Democrat, like pro-life, pro-choice. But when you walk into a hospital, it is people versus people. It is heart versus heart. To think that in a whole entire hospital system, no one thought to care about these women just from the heart. That doesn't make any sense to me. And I said that I was going to bring this up. I'm Catholic. I was raised in Cameroon Catholic. And until I came to the States, there had never been a question for me of my faith and like the things I was going to do with my life. Every time the subject of pro-life comes up, there is always that thing with the church that says, oh, we pray for the preservation of life from conception to natural death. The two places that this always strikes me are when we talk about abortions and when we talk about people getting gunned down, especially Black people. When it comes to preservation of life, I always wonder why there isn't more noise, there isn't more support for preservation of life after the period of conception. I always wonder why we are so fixated on the whole abortion thing. Because the women who are carrying the babies, no one cares about. The women who have to take care of those children, no one cares about. The children who are struggling because they don't have the basic necessities to go through life, nobody cares about. The mental health of people who are just trying to live every day, nobody cares about. People who are shocked in the street, in their homes. Like, why don't we put the same effort that we put towards this into all of that? This is a health problem. It is a political problem. It is a humanity issue. And yet we pigeonhole our effort because all we want to do is control people. Every day, people go out there and they die. Every day, women are scared to enter the hospital. And I wanted to bring this up for myself because as a person who is hoping to start a family soon, I'm scared. As a physician, I am baffled. Like, we swore an oath to take care of people irrespective of who they are. How is this happening? How does this continue to happen? I keep thinking that, outside of government, outside of politics, outside of all this nonsense and all this noise, we just need a list, right? In every state, there needs to be a list of hospitals that know that every single person in that hospital has it in their heart to hold every single patient to the same standard. And we're not just talking about writing it on the vision board or on the mission statement or anything. Really, really care about people. There just needs to be a list of hey, if you are pregnant and you are worried about where you live and about whether you're going to get great care, come here. We will take care of you. We will do well. Because it doesn't make any sense to me that we are inundated by healthcare facilities. We are surrounded by hospitals and people with the knowledge of biology, people with the knowledge of how this is supposed to work, people who make it their life choice to take care of women, to take care of babies, cannot even bring theirs into the world. Women die from preeclampsia. Women die from postpartum bleeding. Women die from all the other complications of pregnancy. Black women in their numbers. And everybody is busy running around telling people not to have abortions, busy running around telling people to go have babies. Like, I don't get it. I'm scared. I am afraid. How am I going to bring a baby into this world? Where am I going to bring a baby into this world? Who is going to help me through it? If every time that somebody that looks like me shows up at the hospital and gets this kind of treatment. And I'm not just saying that because there is a woman out there whose family is heartbroken today. I'm saying it because throughout medical school, I have had my own family members, my own friends go through the system, the OB-GYN system, go through the healthcare system, and just being repeatedly failed. And I'm so torn because I am part of the healthcare system. I am one of those people that needs to be able to do good work for people. But then who's looking out for us? Who is sitting in their houses and thinking that we are valuable enough, that our lives should be protected, that our children should be cared for, that we should be offered the same care that would be offered to our counterparts if they showed up? I'm very sad and I'm very confused and I don't understand. And this is not a post with a solution because I am just me sitting in my tiny room, barely out of medical school, trying to understand a system that has been like this for years and years and years. I don't understand it. This is a person I actually, once I saw this morning, I went over to Instagram, as I think many people did, and I looked her up. This was somebody who had just gotten married. This was somebody that was starting their life. She could have been me. We both got married in 2024. We're both looking forward to having kids. And that's it. I say in my first episode of this car therapy series that I have a lot of irrational anxieties. This is my biggest one. That I would try to have a baby. I would get pregnant. And then my problems will start from there. Because I would not have confidence in the people that touch me, in the people that try to lead me through my pregnancy, in the people that try to lead me through childbirth. I am losing sleep over this, personally. And I don't understand how we can make Black women feel safe about walking into hospitals and having babies. I don't understand how we can make Black women feel safe about leaving their children at home to go have babies and coming back to those kids. I don't know what the solution is. This is just me ranting because I'm doing my self-therapy thing. But I am very confused. I'm confused, I'm heartbroken, I'm sad, and I'm just really, really anxious. If you have gotten this far, thank you for watching. Thank you for listening. Have a happy Sunday, and see you tomorrow.